My name is Brittany Helms. I'm a nurse practitioner student with Maryville University. Lisa is my patient today. We obtained her height, weight, and a full set of vitals. We had her change to a gown and empty her bladder before this examination. I'm going to start with a general inspection of Lisa. She is a 40-year-old Caucasian female, dressed appropriately, well-groomed, pleasant, and cooperative. I'm now going to do inspection of her head and face. Her head is upright and still. Her face is pink and symmetrical in color. And I'm now going to palpate her head. It's normocephalic. The skin moves freely over the skull. I'll check for any depressions, any lesions, areas of tenderness. Her hair is evenly distributed, blonde in color, soft. There are no patterns of baldness noted. I'm going to go ahead and palpate Lisa's face next for any areas of tenderness. Just let me know if it hurts, or for any nodules or any deformities. And none are found. I'm going to go ahead and palpate her frontal sinuses. And let me know if this hurts at all. And maxillary sinuses. And there's no edema, and she verbalizes no tenderness. I'm going to go ahead and palpate her temporomandibular joint. You could go ahead and open your mouth for me and close it, and it's free of clicks and crepitus. I'm going to go ahead and do light sensation at this time, which is testing of one of the cranial nerves. This is soft, and this is sharp. Okay. And if you could close your eyes for me and tell me what sensation you feel. Soft, sharp, soft, sharp. Good. And I'm going to now have you, can you wrinkle your forehead for me? Can you clench your eyes shut, puff out your cheeks, clench your teeth, smile, and stick out your tongue. And this is also testing some of the cranial nerves. I'm going to go ahead and inspect the eyes. The eyebrows are present and symmetrical. With the eyes, there's no ptosis noted. The eyelashes are growing outward, and the sclera are white. I'm going to go ahead and check your conjunctiva. You could look up for me. And the conjunctiva are translucent and free of redness. And I'm going to go ahead and palpate your lacrimal apparatus. You could just close your eyes, and I'm noting that the eyelids close the eye completely, or cover the eye completely when closed. Palpate the lacrimal apparatus for any tenderness, swelling, nodules, deformities. Does that hurt at all? Oh. And then I'm going to go ahead and check your pupillary response at this time. You could just stare at the wall straight behind me. I'm just going to shine this light in your eyes. And noting that the pupils are round, reactive to light, pupils are equal, round, reactive to light. And I'm going to test your extraocular eye movements at this time, which is another thing that will test the cranial nerves. You could just follow my finger with just your eyes and not move your head at all. Good. And now I'm going to check your visual fields. So if you could just let me know when you see my fingers coming up in your peripheral vision. Now. Good. Now. Good. And next I'm going to go ahead and grab the ophthalmoscope and check your red light reflex. Okay. You could just stare straight ahead again for me. The red light reflex is present. I'm just going to check the other eye. And the red light reflex is present. I'm now going to continue on with inspection of the nose. The nose appears symmetrical and straight. The nares appear even. I'm going to palpate for any deviations. No deviations are noted. I'm gonna check the patency of your nostrils. If you could breathe in and out for me. And breathe in and out for me. Good. I'm gonna go ahead and have you tilt your head back a little bit. I'm gonna shine my light. And the nasal mucosa and turbinates are both pink in color. I'm going to start with our next, move on to inspection of the mouth. The lips are pink, moist, no cracks noted. I'm going to go ahead and have you open your mouth for me. And the gums are coral pink in color. The teeth are ivory and white. At this time, I would count the teeth and note any cavities, loose teeth, or cracks, and there are none. There's no mouth odor present. The buccal mucosa is pink and moist. The posterior pharynx is pink and glistening. The tonsils are within the tonsillar pillars. The uvula is midline. The hard palate is dome-shaped. The soft palate continues from the hard palate. The tongue is smooth and pink. Can you lift your tongue for me? There are no ulcerations noted. The tongue moves symmetrically. There are no discolorations or nodules in the mouth. Okay, can you go ahead and say ah for me?
Ah.
And with the ah reflex, her uvula remains midline and the soft palate raises. I'm going to go ahead and check your gag reflex. Gag reflex is present. I'm going to go ahead and inspect the ears, and they appear symmetrical and even. I'm going to palpate the ears. There are no nodules noted, any tenderness at all. Okay, at this time, we're going to go ahead and perform the whisper test. I'm going to stand out of your vision and behind you about a foot, and you I'm going to whisper a combination of 3 letters and number combination, and you just read back to me what you hear. I'm going to stand back here. Can you go ahead and occlude your right ear for me?
PL2.
Okay, I'm going to go to the other side. You could just occlude the other.
J4D.
Good job. And at this time, we're going to perform the Ren test with this tuning fork. I'm just going to hit it to where it vibrates, and I'll place it behind your ear. And you tell me whenever you stop hearing it, whenever it's placed on that bone. And then when I move it to the front of your ear, you stop. Let me know when you stop hearing it through the air. Okay.
Now. Now.
Okay, and you're noting that air conduction is greater than bone conduction. Air conduction is twice as long as bone conduction. We're going to repeat this test with your other ear.
Now. Now.
Okay, and again, air conduction is twice as long as bone conduction. We're now going to move on with inspection of the neck. The neck appears symmetrical and even. And the skin color is pink. There's no jugular venous distension and no prominence of the carotid arteries. So next we're going to palpate. I'm going to palpate the carotid pulse one at a time. The carotid pulse is present and strong. Going to go ahead and palpate the trachea and note that it feels midline and even. Can you go ahead and swallow for me? It remains symmetrical. I'm going to go ahead and palpate your thyroid at this time. What I'm going to have you do is lean your head down to your left and kind of flex forward. I'm just going to displace your trachea and or displace your thyroid and hook my fingers around, and I'm going to have you swallow. And then I'm going to repeat with the other side. If you can go down into your right, here you go. You can go ahead and swallow. Okay, and I'm going to go ahead and palpate your lymph nodes at this time. I'm going to start, and I'm just going to name them as we go through and palpate them. I'm palpating the preauricular and the postauricular, the occipital, the tonsillar, the submandibular, the submental, the superficial cervical chain, your deep cervical chain. If you could just go ahead and there you go. Okay, tilt to the other side. And then your supraclavicular. I'm going to go ahead and palpate the infraclavicular at this time. If you could raise your arms for me, I'm going to palpate the axillary node. Okay, and I'm going to next auscultate your carotid arteries with the bell of my stethoscope. I'm going to ask you to hold your breath for me while I listen. Okay, can you hold your breath? And you can breathe normal for a minute. I'm going to have you hold your breath again. You're going to auscultate the thyroid. And no bruise are heard. This time, Lisa, we're going to go ahead and do some range of motion. Can you go ahead and touch your chin to your chest for me? Okay. And take your chin towards the ceiling. And now can you take your chin towards one shoulder and your chin towards the opposite shoulder? Can you go ahead and take your ear towards one shoulder and your ear towards the other shoulder? Can you shrug your shoulders for me? Now we're just going to repeat a few of those with a little bit of resistance. Against my hand, can you go ahead and take your chin to your chest? Good. And rotate your chin towards your shoulder. Good. And again. Okay, and can you shrug against my hands? Good. We're going to move on to the upper extremities. I'm going to start with inspection. I'm going to note that the shoulders are symmetrical and equal in size and contour, that the arms appear equal in length, and that there's no obvious deviations upon inspection. I'm going to go ahead and palpate the upper extremities. I'm going to start with the shoulder and just go all around the shoulder joint and go around to the scapula and come back and go down the arms, and I'm going to note that they're equal in warmth and there's no atrophy noted. I don't feel any lesions, I don't feel any nodules. Get to the hands. I'm going to palpate the joints for any nodes or nodules or swelling or tenderness. And I'm going to check the capillary refill, and it's less than 2 seconds. The nail beds are pink in color. There are no deformities of the nails, no clubbing of the nails noted. I'm going to palpate the brachial pulses, and they're equal in strength and strong. I'm going to palpate the radial pulses, and again they're equal and strong. I'm going to go ahead and have you turn to the side for me, Lisa, and I'm going to do the posterior chest and back next. Okay, and I will start my inspection of skin color. The skin appears pink, even. There's no lesions noted. And I would check thoracic configuration at this time and note that the AP diameter is less than the lateral diameter. I would palpate for any masses, nodules, or tenderness. Any tenderness at all?
Mm-mm.
At this time, I'm going to palpate the costovertebral angle, and I'm going to go ahead and percuss for any tenderness. Does that hurt at all?
No.
Does that hurt at all?
No.
Good. And I'm going to go ahead and inspect respirations at this time and note that they're